Hello to each and every single one of you. My name is Abhiram H. Nambia and I am an FIE student here at Purdue. Now, firstly, I would like to thank Professor Mann for providing us such a wonderful opportunity to culminate on what has been an enthralling course thus far. Now, today, my presentation delves into the most Googled topic of 2020 and 2021. Yep, you guessed it right, it's COVID 19. Now, this delves into what went right, what went wrong, and what role did politics play in COVID 19. Now, without any further ado, let's get right into it. Okay, let's go to the next slide. Okay, here we go. Okay, so I know many of you don't need an introduction to what COVID 19 is, but I'll give one nonetheless. So, coronavirus disease or COVID 19 is a profusely contagious disease caused by the diminutive virus called SARS CoV 2. And now, SARS CoV 2 has a special protein called the M protein. Now, based on the percentage of this M protein, COVID has four different variants, which are the alpha variant, the beta variant, the gamma variant, and the delta variant, which is currently pervasive right now in the US. So, here we can see that it is ensued in one of the largest global pandemics of all time since the Spanish flu, which has plagued the world in about 1916 to 1920, that time frame. So I know many of you know this, but I'll just say some of the few common symptoms like fever or chills, you have cough, incessant vomiting, diarrhea, etc. So now we get into the good stuff. Now, what went right? The most incontrovertible success of this unprecedented crisis thus far is definitely the advent of vaccines. Now, less than a year after the pandemic has confined people within the confines of their homes, Pfizer and Moderna came up with respective vaccines, at an astounding 95% efficacy rate and gained instantaneous traction, thereby paving the way for other vaccines to be formed at an expedited rate. Now, what the vaccine does, the vaccine precludes COVID 19 hospitalization and death. And despite this traction, certain people, like especially Republican voters, they express certain hesitancy towards this vaccine and they coax other people into abstaining from them because they apparently taint their bloods. So now let's get into this graph, which will give you a clear idea about the vaccines. Okay, so right now you can see this graph where the daily new cases are represented by the red line and the number of doses administered is represented by the blue line. So you can see when the first vaccine was administered, cases started to increase slowly, but then after that it decreased substantially. And this is because of the effect of the vaccine that suppressed the effects of COVID 19. And once it did that, the number of doses administered, because it convinced people that vaccines are the way to curb the effect of COVID 19. So now let's go to the next slide. Okay, so now we get into the next point of what went right. So now all the frontline workers, they were the unsung heroes during this unprecedented crisis because despite the hospitals being inundated with a lot of patients, they persevered through it all. They showed up shift after shift and persevered through all the terror, exhaustion, and unmitigated trauma. Lastly, the public's handling of COVID 19 for the most part was good because they adhered to COVID protocol like mask wearing, social distancing norms, and they avoided any unnecessary risk. So now we're talking about a media environment where misinformation is quite pervasive. Now, scientists, for the most part, they categorically debunk this misinformation by setting the record straight. For instance, when Trump made unsubstantiated claims about the safety during COVID 19. So now let's get to the next slide of what went wrong. Yeah, so right now we're going to talk about what went wrong. So now the first point is the downplaying of danger. At the beginning of the pandemic, Trump and several other authority figures proactively minimized the threat of this virus. Trump even falsely proclaimed this virus as no worse than a flu and that it would be all over in Eastern. Now, despite the several warnings from CDC, the Trump administration indecorously suppressed their warnings, making it difficult to reach out to the public. However, the Biden administration revered and valued the CDC's opinion, therefore facilitating the dissemination of accurate information quite easily to the public. So now let's go to the next slide. Okay, so right now we go into the last part of what really went wrong with confusing mask guidance. Now, although these face masks are absolutely consequential in preventing the contraction of the coronavirus, WHO and CDC were quite slow to issue them. However, as the cases began to proliferate over time, CDC issued a mask mandate, well, not mandate really, a recommendation in April and WHO in June. Despite the health officials reaching a consensus regarding the mask mandate, Trump, however, absolutely abjured from wearing masks, and subsequently, his supporters stopped wearing masks as well, indoctrinated by his abstinence. Now, if Trump had been extremely serious about the pandemic, he could have saved over 130,000 lives in the fall and winter cycle if he had implored them to wear face masks. Okay, so right now we go towards a conclusion. Right now, we are in the last slide. How can we attenuate the spread of this deleteriously contagious disease? Firstly, get vaccinated. They are safe and, for all intents and purposes, effective against COVID 19. Also, we must ensure that we adhere to COVID protocol and social distancing norms. So now, okay, I'm sorry about that. The slide transition took longer than I thought, but right now, before I thank all of you, I would like to entreat all of you to think about what went right, according to you. What went right during the COVID 19 pandemic and what went wrong during the COVID 19 pandemic? Could be anything, environmentally or about the complacency of the public as well, that imputed to the exacerbation of this pandemic. So I want all of you to think about it. Okay, so with that, I thank all of you and hope all of you have a great day. So bye for now.